So this is the 360-degree view of the exam room here at the hospital. The patient is already set up. The rolling bedside table contains everything that I would need except for a piece of paper. Napkin. We can use a paper towel. So we will use this paper towel for the follow the directions portion of it. Clear view of everything? Okay, let's start. My name is Melissa. I'm going to be your nurse today. I'm here to do a physical assessment on you from head to toe. Can you start by verifying your first and last initial? JW. And your date of birth? 4/9. Okay, so at this point, our identity is confirmed. We would start the assessment starting from the head down or the feet up. Normally they would be in a hospital gown. Unfortunately, we are working, so she is in her scrubs. So we will start. I'm gonna take off your socks. Go ahead. So, assessing her skin, assessing her feet. So the skin is warm and intact. She's got good capillary refill on her toes. There's no edema. I would do the skin turgor test. There's no tenting. While I'm working my way up, just examining her, I'm going to stop and palpate pulses. So pedal pulses, dorsal pedis. I would move up to the popliteal, which is right underneath her knees. I would then move to her femoral, to her radial, up, and I'm going to come back and test the carotid again. So at this point, skin is intact. I'll check your nails. Again, capillary refill is less than 3 seconds and good. Skin is still warm, dry and intact. So what I'm going to do is we start with her head. I'm going to feel her head for any abnormalities. Look at her hair growth pattern, and then start with her ears and eyes. So I'm going to have you lean forward. She has no irregular hair growth patterns, no abnormalities in her scalp. So what you would do is, I'm going to have you take off your glasses for me. I would feel her temporal pulses. I would auscultate them as well. Since I already felt the carotid, I'm going to auscultate each side as well. I'm also going to feel her lymph nodes. I'm going to feel her clavicle lymph nodes. And then I'm going to feel her axillary lymph nodes as well. So at this point, I'm going to look at her ears. I'm using our pen light here. So I'm shining the light on the outside of the ear while also feeling it. we will do the whisper test where I whisper something in her ear and she has to repeat it.
Today is a sunny day. It rained yesterday.
Hearing is impaired. I'm going to palpate her sinuses, her upper and lower lids as well at this point. Close your eyes for me. Any pressure or pain? Nope. Okay. Now I'm going to start to inspect the eyes. I'm going to look for accommodation. I'm going to look and see, test her movement, her ocular movement. So briskly accommodates. Briskly accommodates. So what I'm going to have you do is look straight ahead and just follow my finger with your eyes, not your head. No nystagmus or abnormalities. We're going to move on to your nose. So I'm going to inspect your nose, shine a light up to make sure there's no blockages. Right now, can you do me a favor? With each nostril, you're going to cover one nostril and blow out. Both mirrors are patent. Both mirrors are patent, no debris or blockages. I'm going to have you close your eyes. That is what she's going to smell. What do you smell?
Hand sanitizer.
Do you smell anything else?
It's Christmassy.
Okay. Thank you. Keeping your eyes closed, I'm also going to test your reaction. Tell me if the touch is dull or sharp.
Dull. Dull. Sharp. Sharp.
Okay. So we've checked that. Now we're going to check her mouth. So we're going to start by, if you can open and close your jaw. I'm checking for TMJ. Okay, can you move your jaw left to right? Okay. I'm going to look in her mouth, make sure that there's no abnormalities in her mouth. So we're looking for pink, moist mucous membranes, no redness in the back of the throat. Can you open your mouth, stick out your tongue, and say ah? Okay. So, throat looks good. Tongue is intact, pink, moist. So, now I'm going to have you are going to stick your tongue out. You are going to go left to right and then up and down.
Okay.
Okay. Good. So, moving on from there, we've already checked her carotid. We've listened to each carotid. We are going to move down to her chest. So I'm going to lean the bed back just a little. Tell me if you're comfortable. It's good. Okay. So we're going to listen to her heart sounds in all of the aortic, pulmonary, the herbs, all of those. We're going to listen to make sure we don't hear any abnormalities. So go ahead. Oh. Aortic, pulmonic. That's the second left intercostal space. Okay. The herbs is going to be the third. The tricuspid. Sorry, I'm going to have to press a little hard. So heart sounds are normal. You hear S1, S2 throughout all 5 of the fields that I checked. At this point, you can check for JVD, which I would lay the head of the bed down a little bit more. And I'm going to have her turn her head from side to side. Sorry. So you're going to start by turning your head to your left. So it's non-distended. Okay, if you turn your head to the right, non-distended. Okay, I'm going to slowly sit you up. So now we would listen to her lung sounds. So we'll listen to the front and then we'll go on and listen to the back. Okay. Can you forward for me? Now I'm going to flip the bell over and listen to them as well. And you say 99.
99, 99, 99, 99, 99, 99, 99.
While I have her sitting up, I'm going to percuss her back. I'm going to take the bell and listen to her lung sounds. Anteriorly as well. You say 99?
99, 99, 99, 99.
I'm going to percuss as well. Okay, so lung sounds are normal. There's no wheezing, no rhonchi, no crackles, nice clear lung sounds throughout. So then we would move on to the abdomen. And what you're going to do is I'm going to start by listening. So I'm going to listen to her aortic sounds, her renal arteries, and then her femoral arteries. And then I will listen to the 4 quadrants. Then I will palpate and percuss. And then we listen to her. Okay. Listen to the 4 quadrants in a zigzag pattern. And I always listen before I percuss because percussing and pressing can cause the vowels to make sounds. And then tell me if you have any tenderness. Nope. Okay, perfect. So we have done the chest, the lungs, the abdomen, We have looked at her skin, we have looked at her head. We will now move on to her neurological and muscular skeletal. In these, we're going to ask questions about what she did for her last birthday. We are going to have her walk for us. We're going to have her do some basic range of motion. We're going to test her Romberg's, her stereogenesis, and her Gracivis. So I'm going to start by having you close your eyes. So what I'm going to do is I'm going to put an object in one hand, and I want you to feel it and tell me what you feel.
A coin.
Okay. I'm going to take your other hand now. Oop, got caught on me.
A paperclip.
Perfect. With your eyes closed, I'm going to take this pen and I'm going to write a letter on your hand, on the palm of your hand, and you tell me what letter I wrote.
C.
Okay.
R.
Yeah. Okay. All right, so that was that. Romberg's test we're going to test when we stand up, and that's where you're going to stand on one foot
Okay.
with your eyes closed and try and balance. So what I'll start with is the upper range of motion. So can you move your neck from side to side and then forwards and backwards? Okay. And then do that while pressing against my hand. Good. On this side. Good. Okay. For your arms, I'm gonna move the table over. So for your shoulders, you're gonna do the same thing. So extension, flexion, and extension. So flexion is up above your head, extension is down behind you. So if you could do that with your shoulders, if you feel more comfortable sitting at the edge of the bed or the foot of the bed, or if you want to do it there. So up and then down. And then yeah, there you go. So you're gonna do the same for the arms. You're gonna sit with the arms and the elbows. So you're gonna sit like you're in the muscle position. And you're gonna flex in and extend down. Yep. And then so the elbows. Arms, it's gonna go straight down and you're gonna go up and back down. Okay. Perfect. And then wrists, you're gonna do the same. So you're gonna go down and up. And then you're gonna go side and then just for giggles. Okay. The other thing we're gonna test is your hand strength. So each thing, yeah, you're gonna squeeze at the same time. Perfect. And then don't let me pull you, so don't let me pull you towards me. Good. We're gonna continue down with your hips. So this one is the abduction, so the in and the out for your hip joints. Okay. Sorry.
It's okay.
So, yeah.
Out.
Perfect. Okay. For your knees, it's gonna be you're gonna go up and down and down. Yep. Good. And then for your legs, you can swing them back over and it's gonna be up and down. Right. So we're also going to test by having you run your heel to shin on each side. Yep. And then for your feet, it's going to go down and up, down and up. You're going to push against my hands like gas pedals. Pull back. Perfect. And then can you roll your ankles around? Perfect. So the other part of this is I'm going to have you come and stand. Yep. Oh, sorry. So we're going to test your balance. So you're going to walk just normal and then back to the chair. So you're going to walk a couple times. Next time, can you walk on your tippy toes? Perfect. On the way back, can you walk on your heels? Okay. On the way towards me this time, can you walk heel to toe, like the sobriety tests?
Oh, okay.
Yep. Perfect. And then the last one I want to just test is a rapid sequence. So just do high knees back to the chair. Okay. So remember how I said the Romberg test we're gonna do? So what you're gonna do is you're gonna close your eyes and you're gonna start out on your left, pick your foot up, and hold with your eyes closed. Okay. And then on your right. Yeah, that's okay. All right. You can take a seat. Now we're gonna ask. What I'm gonna do is I'm going to write instructions on this piece of paper towel. And you're gonna follow those instructions. Okay. Just don't fall out of bed. Perfect. So now we're gonna ask some. We'll finish the exam by asking some neurological questions and testing that. I've got one part. Hang on. So I'm gonna have you roll up your sleeves. Close your eyes and we're gonna do the sensory again. So you're gonna tell me if it's dull or sharp.
Dull. Dull.
That's dull.
Sharp.
Okay.
Sharp. Dull. Dull.
Okay. I'm gonna have you do the same with your legs. We'll roll up your leg a little bit. Eyes closed.
Dull. Dull. Sharp. Sharp.
Okay. All right. Sorry about that. I completely forgot about that. So now we'll ask some orientation and neurological memory questions. So, what is today's date?
June 16th, 2003.
Perfect.
2023.
2023. Perfect. Where are we?
We're in Muscle.
Okay. What did you do for your last birthday?
Went to the casino.
Perfect. Can you count backwards?
Oh boy.
I know. Can you count backwards from 100? By 7?
Oh,
Or was
geez.
it 9?
I don't remember.
9 by 9.
Okay, so 100, 91, 82,
Mm-hmm.
73,
Yep.
64,
Mm-hmm.
55,
Mm-hmm.
46,
Mm-hmm.
37,
Mm-hmm.
28,
Mm-hmm. Okay, we'll stop. I can see you counting on your fingers. We'll stop there, but you got it.
Yep.
I'm gonna ask you to remember 4 words,
Okay.
and then I'm gonna ask you a question, and then um I'm gonna ask you 4 words. I'm gonna have you remember 4 words, and then I'm gonna have you count backwards from 20, um, and then repeat those 4 words.
Okay.
So cat, hat, ball, map.
Okay. 20, 19, 18, 17, 16, 15, 16, 13, 12, 11, 10, 9, 8, 7, 6, 5, 3, 2, 1.
Okay, and what were the words I asked you?
Cat, hat, ball, and map.
Perfect. Okay, so that concludes our exam. Thank you for participating.
You're very welcome.
Do you have any questions for me?
Nope.
All right. Given our first encounter, we talked about your health history, and that you are a smoker. I'm going to get you some education on smoking cessation, and then just follow up with your eye doctor as well.
Mhm.
And we'll go from there.
Okay.
Okay. All right. Thank you.
Thank you.